What's up, everybody, and welcome to this week's episode of the Well Man's Podcast. My name is Brian Brosey. I'm joined by my friend and co-host, Keoni Tita. Keoni, how are you today?
Wonderful. Glad to be back on with everybody.
Yeah.
I recently just did an online course, herbal medicine course, and anyway, one of the lectures that I listened to was just fascinating. It was done by a guy named Jason Miller. He's a doctor of acupuncture and Chinese medicine. He's also an acupuncturist, but he gave a wonderful lecture on prostate health. And so I thought today we'd just talk about that because I don't know if you know this, but the prostate for the man is like our health nemesis, right? I mean, most men are going to have some issues with their prostate in their lifetime.
Yeah.
And unfortunately, like 1 in 6 men are going to get prostate cancer during their lifetime. And there's some big changes that are going on, recommendations with how prostate cancer is treated, how from a conventional standpoint, and a lot of the stuff is outdated now. I mean, there's just been changes in the last few years with how we go about doing this. And one of the things that I really wanted to bring to light during this talk is a lot of men who have been diagnosed with prostate cancer jump right into the conventional treatments. And for any type of cancer, the treatments usually are radiation, surgery, some form of maybe chemotherapy. With prostate cancer, you have what's called androgen deprivation therapy, or ADT. And they're pretty harsh treatments.
Right. Yeah, absolutely.
They can leave a lot of men with really poor quality of life issues afterwards. And what we're finding out is that many men didn't need to have any of these treatments. Many forms of prostate cancer are very slow growing and don't even need to be touched. In other words, before that cancer even causes the man a problem, that man is long gone, probably died of other causes, maybe even just old age. So, when you hear cancer, everybody kind of has this fear thing about it, get it out, let's fix it, let's do this. And, the main risk factor for cancer, as we've talked about in a number of podcasts, is just age itself, right? And this is, male reproductive cancer. And it's one of those things that doesn't have to be that scary. And then when you combine it with natural therapeutics, you can do a whole lot to just help keep the health and function of the prostate.
Okay.
Yeah. But when we started, I've just said, like, most men are going to have some issues with their prostate. Like, most men will experience like benign prostatic hyperplasia where the prostate kind of swells. Some of the symptoms are urinary in nature, where it kind of contracts on the urethra coming out of the bladder, the neck urethra connection there. That's kind of where the prostate holds itself, it resides. And just a little bit about the anatomy, and this probably better than I do at this point, but it sits there in a highly vascular area. It right there in the perineum, a lot of lymph flow through there, a lot of blood vessel flow through there. And one of the biggest risk factors for prostate problems is just being sedentary, lack of exercise.
Yes, kind of a lack of movement in that region.
Right, lack of movement. So if people are exercising, it's kind of like you clean out the house by moving, getting the blood flow constantly going. I mean, if you're spending your whole life sitting on that prostate, which men do, sitting in that region, you get a lot of stagnation there, for lack of a better term. That's a medical term, stagnation, by the way. Actually, just kidding. That's actually a term that we would say in Chinese medicine, right? So there's blood stagnation, qi stagnation, and therefore you can't clean out that area on a daily basis. Exercise is one of the big things that we can do to help the prostate.
Yeah, absolutely.
A lot of other risk factors also. So obesity is the big one. Kind of goes with lack of movement. Diabetes. There is a genetic component. There is a family history component to it.
Mm-hmm.
One big thing that we find with prostate, just go into PubMed, type in vitamin D and prostate health. So lack of sunlight, not having enough vitamin D, smoking is a risk factor for many, many cancers, but prostate definitely. Certain like pesticides, mold exposure, heavy metals, viral infections. A big risk factor is shift work. Says something a little bit about sleep,
Right.
right? So if you're working third shift and you're not getting adequate sleep, that's another risk factor. So a lot of these things, if we can think about these before it actually happens, can help keep that prostate healthy.
Yeah, absolutely. Fair amount of modifiable things in there.
Yeah. So a lot of lifestyle stuff that can really help. And not only that, with that lifestyle, those lifestyle issues, if you can clean your lifestyle up, you're going to be more likely, if you do get prostate cancer, to have a less aggressive form. And if you have a less aggressive form, then what does that mean? You probably don't need radical treatment,
Mm-hmm.
real invasive treatment. So, all right. So all of those things qualify as certain forms of stress, more physical, but also mental stress plays a role. We see stress being a big contributor to prostate health or health in general. So you get, beta adrenergic upregulation, you get cortisol secretion. All of these things play a role in kind of pulling resources from repair and growth to resources into fight or flight, so to speak. So, it's that analogy of, if there's a bomb threat, everybody goes into hiding and the community can't grow. Well, you can think about that as happening in the body also. So when you're under stress, and when you're under stress, what happens? You may get immune dysregulation. You get immune dysregulation, you cannot heal properly. That shifts hormones around. You get endocrine disruption. Overall, if it keeps happening like that, you're no longer in growth, so therefore you are more catabolic in nature, so you're breaking down. Your body's cancer surveillance system, your immune system, just doesn't work as well. It doesn't tell the cells to kind of destroy themselves and go into apoptosis.
Yeah.
And this is one of the reasons why shift workers have some of the biggest issues, right? Because they are a group of people, of individuals that are under tremendous stress, whether they realize it or not, by just, being off kilter with their circadian rhythm.
Yeah, absolutely.
So speaking of that, sleep is a huge issue. And the thing about sleep that a lot of people don't know is, before food, sleep is probably the third most important thing that you need to sustain life. So, you're not going to live you're not going to live very long without air, and you're not going to live very long without water. You can actually live like a month or two, maybe up to 3, 4, 5 months without food. But with sleep, after about a week or so, it could kill you if you don't get sleep. So sleep is very important, and we don't put a lot of stress on sleep. Like for some people, it's like, I can just survive on 4 hours of sleep. Like that's a pat on the back, or they should get a gold star. And it really is detrimental to your health.
Yeah.
Big time.
Yeah. It's a shame this type of information and education doesn't come along with, kind of finding out about these diagnoses if and when given them or diagnosed with them.
Right. So you're right. And so if this information was given out long before this diagnosis happened, I mean, you're going to see less aggressive forms, and you're not going to see as many diagnoses of cancer because it's not going to be there.
Yeah. And everything you just said, kind of keeping the system efficient.
Right. Keeping the system efficient is so important. Hypoxia in the region, this kind of speaks to exercise, right? Think about exercise and what it does. It kind of nourishes the tissue, oxygenates the tissues. It's very, there's a chemical messenger called hypoxia inducible factor 1 alpha, or HIF1, and this is overexpressed in many cancers, and it's heavily implicated in promoting tumor growth and metastasis, where the cancer can spread. And cancer really likes to be in a low oxygen environment, and this is one of the reasons why we think exercise and movement really helps.
Yeah, I'm glad you mentioned that, because as a PT, you see a lot of people undergoing, if they are undergoing chemotherapy or radiation or those sorts of things, kind of decreasing their exercise. And that is not necessarily what's recommended at all.
No, you definitely, I understand with a lot of people that go through that, they're
Mm-hmm.
under a lot of stress. They probably feel awful, but if you could
Yeah.
just do light exercise, it helps tremendously, like light walking or a recumbent bike, light pedaling, just to get the blood moving. Yeah,
Yeah.
absolutely.
100%.
Yeah. Um, and just reiterating what we already said, by the way, prolonged sitting is associated. It's a risk factor for all cancers, especially prostate cancer, since that's what you're basically, as men, we're sitting on the prostate constantly. So it's time to get moving there.
Yeah. Think about that every time your Apple Watch tells you to get up and get moving.
Oh,
You're
right.
just sitting
Yeah.
on your prostate.
Yep. Um, a big issue is all the environmental estrogens that are out there. A lot of them mimic estrogen. And one thing about prostate cancer is the prostate seems to, like other reproductive cancers, would swell with excess estrogens in the body. One of the things we'll get into this talk is the whole thing about how testosterone's role. And testosterone used to be considered the bad guy in prostate cancer, and it seems to be actually a good guy with more research that we're having. The bad guys seem to be excess estrogens for men, but also when testosterone gets converted into dihydrotestosterone or DHT. But speaking of the estrogen aspect of it, we know estrogens play a role in increasing your risk of prostate cancer, and there's a lot of estrogens in the environment. So we have things like plastics that are estrogen mimickers, and they disrupt your hormonal balance. A lot of them are called endocrine disruptors. One of the big ones that has gotten a lot of play in the media, at least a few years ago, was bisphenol A, or BPA, and it's one of those chemicals that are found in plastics. So you'll see a lot of plastic bottles out there that say, this is BPA free. And there was a lot of controversy about that, and that it wasn't a big deal, but it actually is a big deal. And there's a lot of research to support that you really don't want this stuff in there. But unfortunately, it's not the only chemical we need to worry about. And there's lots of, if you're drinking out of plastic, there's lots of other chemicals found in plastics that can act like these estrogen, as endocrine disruptors, and can mimic estrogens. A lot of pesticides, herbicides also can mimic this stuff. So it's like you really want to do your best to try to mitigate this stuff as best you can. And so with some of the podcasts that we've had in the past, we went through some of this stuff as far as like, all right, let's keep your liver healthy. How do you detox appropriately? That type of thing. Drinking plenty of water. Don't drink out of plastics. All this stuff plays a role.
Yeah.
So endocrine disruptors are found in all kinds of things. You certainly don't want to be microwaving in plastics and eating out of plastics or eating hot dishes out of that if you can help it. It all plays a role to our detriment.
As far as you know, is glass the best option, Keoni?
Glass is probably,
we're in now?
glass is probably going to be the best thing to drink out of. Absolutely. Not plastic. And not to mention, plastics, just accumulate, don't break down well at all. Glasses seems to be easy to recycle and all that stuff, and it doesn't have the negative impact on the environment that plastic seems to have.
Yeah.
And also for our bodies, so you're not going to get any leaching from glass into the body, certainly not like you would with these chemicals here, these endocrine disrupting chemicals. But anyway, these endocrine disruptors also are associated with increase in BMI, so they increase your risk of obesity. And that therefore snowballs into diabetes and other cancers and cardiovascular disease. We posted it a few weeks ago. We talked about male fertility. These things play a big role in male and female fertility. So if couples are having trouble getting pregnant, we also see it in animals in the wild that these chemicals that we put out into the environment decrease fertility and cause actual infertility.
Yeah. You're slowly kind of accumulating a quiver of all those modifiable risk factors that we
Right.
saw there at the beginning.
Right. And what we did with a number of our podcasts, we've talked throughout ways to kind of combat this accumulation of chemicals that we're exposed to in our environment. But I just want to go over some of the stuff that really can help the prostate, but help the overall body. One of them is support liver function. Okay. And there's lots of things that can do that besides, just doing the general foundational stuff of lifestyle medicine. And one of my favorite of all time liver support substances is the herb milk thistle. And then also things like NAC and glutathione, sulfur-rich amino acids, which are found very high in cruciferous vegetables and legumes and eggs and that type of thing. These things are great. There's other herbals out there, and we'll talk a little bit about these. I don't know if we'll get to it in this podcast, but probably the next one in the series that goes with this are herbs that are called alteratives. And these are just herbs that, basically there's not a really specific definition, but they just help modify the proper function or optimize the function of certain tissues. And it just helps cell communication to go on better. It helps hormonal balance, and they're very, very gentle type of herbals that you can use to help here.
Yeah, back to improving that efficiency of the system.
Right. We did a podcast, I think, way back on adaptogenic herbs.
Mm-hmm.
Right. These herbs basically support the body's ability to deal with stress, and they're very, very important. Any of my patients that go through cancer treatment, I put them on adaptogenic herbs. I mean, it just supports the body to handle that stress. It helps their immune system. Because your immune system gets knocked for a loop when you're getting treated with chemotherapy or radiation. So you really want to try to upregulate it as best you can. Eating tons of colorful vegetables and fruit. There's things in fruits, especially called phenolic compounds. They are so good for you. It's unreal. One of them is known as resveratrol. It's found very high in peanut skins, grape seeds, grape skins. Very, very important for you. One of the herbs called polygonum, that's what most of the resveratrol comes from, is excellent for that. But these phenolic compounds, there's many of them. If you eat the colors of the rainbow, you're getting some. You're getting quite a bit. And these things are very important.
Need to eat Keoni salad.
Yeah, right. Yeah.
I'm having it this week.
The double, triple backflip magical salad.
We call it the ME salad.
The ME salad, right. It should be called the Wellman's Podcast salad now.
There you go.
Anyway, we talked about cruciferous vegetables as far as helping with detox.
In the salad.
Yeah.
I'm just pumping you up here. Boom, in the salad.
Yeah, in the salad, right. A lot of things in the salad that support what's called NRF2. This is a regulator of cellular resistance to oxidants. So any oxidants that come into the body, like certain chemicals, these plant foods and medicines help quell that. So another thing that these plants do, and one of the main things that cancer treatment is kind of geared towards, and what we know about the prostate, are the hormonal alterations that happen. We already talked about them in a little bit. Okay, so we talked about testosterone, estrogen, and dihydrotestosterone. Okay, two things are very important here. There's an enzyme called 5-alpha reductase enzyme, and that enzyme, if it is elevated, will lead to testosterone being more converted to dihydrotestosterone. And that DHT, dihydrotestosterone, is much more potent than testosterone as a anabolic hormone. And it is closely associated with prostate cancer growth and the aggressiveness of it. Okay, so
Okay.
it's associated with a big increase of getting prostate cancer. So certain drugs and herbs, which we'll talk to later, can help block that.
Okay.
Can help block that conversion from testosterone to DHT.
Is there a test that you're aware of that kind of tests the levels of that enzyme?
Um, yes, there is a test that will not necessarily test the level of that enzyme, but can test the amounts of testosterone and DHT.
Okay.
So you get an idea there.
Okay.
The other enzyme is called aromatase. And what aromatase enzyme does is it will aromatize, it will take testosterone and convert it into estrogen, which is not good for the
Right.
prostate.
Again, we don't want, yeah.
Right. And before, I can't reiterate this enough, it used to be that men who had prostate issues, either in a large prostate or prostate cancer, were told that you should not be on testosterone because it can be an issue. And now we're seeing that it's not so much testosterone, it's DHT and probably estrogen. So if we can allow testosterone to do what it needs to do, then it's not a problem to be on it. The problem is when you just give men testosterone without making sure that it's not going to convert into these other things, which conventionally we do. You know, not us as functional medicine practitioners, but most of the times doctors will look at a lab and say, oh, you know, your testosterone is, you know, low. Let's give you testosterone. Well,
Right.
why is it low? Is it all being converted into DHT? Is it being converted into estrogen? You know, and if it is, can we block that? And by the way, when you run testosterone, you should always run your estrogen level also. So estrogen's not only important in men, it's, you know, it's stereotypically known as a female hormone, but it's very important in men. It does have function there. And from an embryological standpoint, you know, I could say this is a fact, guys. I hate to tell you this, but it is a fact that men are nothing but alterated females, because what happens is in embryos are basically bathed in estrogen. And actually the thing that gives the uniqueness to the male brain is estrogen. So there you go. So that hormone is important for us, but it needs to be at a level that our body can handle and not an overabundance. So.
You know, I know I'm asking you off the top of your head, kind of the levels of estrogen that we're kind of aiming for as males.
I don't know. Every lab seems to be a little bit different and have their own numbers. I can tell you in relative terms. I mean, you know, based on, you know, women are going to have a much higher level than men.
Yeah.
Just like men are going to have a much higher level than testosterone to estrogen when compared to women. And I think that's where it gets its rap where, well, you know, estrogen is the female hormone, testosterone is the male hormone. No, men and women need both, and they need it in the appropriate ratio.
Right. When you get your testosterone levels tested, are they typically pairing that with DHT and estrogen, or do you?
Not typically. They should be.
So you
Most
have
of
to
the
be
time, it's
informed
just
to ask.
and most of the time they're just doing total testosterone without doing a free testosterone, which is unbound testosterone, which is the biologically active testosterone. So you kind of have to, you know, ask and say, this is what I want. You know, so
yeah.
In our clinic we have a male hormone panel that does all of that. You know, we just say do the male hormone panel and it does all of that.
Awesome.
So anyway, estrogen in prostate is elevated in both prostate cancer and benign prostatic hyperplasia, you know, or enlarged prostate. So the elevated estrogen to testosterone ratio, it's way high. And you know, what happens is it seems like testosterone gets converted into estrogen, and then it stimulates because again, there's estrogen receptors, of course, right? The estrogen speaks to the prostate. There are estrogen receptors in the prostate that will cause it to swell. So, and guess what happens when you have more estrogen in the body? You increase your risk of creating clots and things like that. So hence, you know, we talked about this before on one of our podcasts, like this is one of the risk factors of taking birth control pills, right? To have estrogen, you can increase your risk of clotting.
Right. And we're seeing that change play out in the research, Keoni, as far as testosterone goes and our further understanding of it being possibly more beneficial than it is a negative thing.
Oh, absolutely. And it goes all the way around. We're not just talking about prostate cancer. We're talking about cardiovascular health. We're talking about controlling blood sugar issues, balancing hormones. And we'll talk about that a little bit more because it's very, very important. It's just we have to be careful about giving testosterone without thinking about the other things that may happen when we give it.
Right.
We just don't want to give testosterone. Oh, your levels are low, we'll give that. Well, we need to take care of these other things to make sure that your body utilizes testosterone in its form, because testosterone is upstream from DHT and estrogen. So it can go to either one of those. Anyway, low T levels, it's an independent risk factor for what we call Gleason pattern 4 on a prostate specimen after having your prostate removed. Anyway, a Gleason score when you have prostate cancer, we're going to go into more detail on this. This is how you get to assess, and we'll be more specific about this, how you assess the aggressiveness of the prostate cancer and basically the prognosis, and if more radical treatments may be, in store for you, or less radical treatments may be in store for you.
Okay.
With prostate cancer, I think a lot of men would have been spared misery that were diagnosed in the 80s, 90s, early 2000s if they just did a surveillance approach, just wait and watch instead of getting it removed right away. Because there's lots of problems with that. You get your prostate removed, there's a lot of nervous tissue there. There's a lot of, blood flow there.
Mm-hmm.
It's very close to the nerves that innervate your rectum and anus. So what are you talking about there? You're talking about quality of life issues that may have to do with frequency of urination, bowel incontinence, erectile dysfunction, and then of course urinary incontinence. And think about that. So you're a 50-year-old man, 60-year-old man, and you have to wear diapers all the time because you can't hold your urine anymore. It's like,
right.
Those are big issues that are not really explained to men, or at least haven't been in the past, about what can happen. Or you get your prostate removed and, now all of a sudden you can't get an erection.
Yeah.
So that's a big quality of life issue for men, where it's not going to happen because the nerve is no longer there.
Right.
So that's a big risk factor. So, I think if men were really explain this in detail, I think there'd be a lot less of these, radical prostatectomies and radical treatments that are, like androgen deprivation therapy, which we'll talk about, which again causes a lot of quality of life issues.
Yeah. Well, let me ask you, Keoni, as being 26, what should I kind of be looking out for on a yearly basis, or whatever the case may be, as I get older?
I think one of the big things for young men to look at is really the flow of urine. Okay. Like, do you have a strong flow of urine? And is that getting weaker as the years go by?
Okay. So that's what I'm familiar with as far as kind of the first sign being that urinary change.
The urinary change. Yeah. That would probably be kind of the first sign of things. Yeah, it's always interesting. You go into a public bathroom, I notice this myself. I'm going on 50 here, and then some young teenage kid comes in, and it sounds like he has a waterfall coming out of his,
sprays it down and it's out.
Oh man, it's like, and you're like jealous. You're like, damn, I wish I could do that while you're just dribbling along, But yeah, that's that's one of the first signs to think about.
Right.
And I will tell you this, men, as we, we're all, especially in our 20s, 30s, we're all about working out with weights and things like that. And we never focus on the muscles that down there to work out.
Pelvic floor. Yeah, absolutely.
Pelvic floor muscles. Yeah. And I got to tell you, here's a shout out to PTs. I have a couple PTs that I refer people to for pelvic floor dysfunction, and it's changed lives.
Yeah, absolutely.
It's completely changed lives for people that they specialize in that, for both men and women. But anyway,
Yeah,
That's
100%.
important. And one of the exercises that people can do now that work those pelvic floor muscles are the Kegel exercises. And we talked about those, right? It's just those Kegel exercises about contracting those pelvic floor muscles. I mean, it's as simple as thinking about urinating, contracting those muscles to stop the flow of urine and releasing, and doing that over a number of times. That increases blood flow to the area down there.
Yeah. So
Not to
thinking of,
mention it tonifies things.
right. Yeah. Great point. So thinking about, if you're sitting now, you kind of feel the bottom of your bowl of the pelvis, almost like you're trying to lift that bottom of the bowl up slightly.
Yeah. Yep.
Up and into the belly.
Yep. Yes. Yeah. And that's if you read about Kegel exercises, there's specific technique to it.
Mm-hmm.
But
Yep.
for our audience, think about, if you want to keep your prostate healthy, think about those contractions and relaxations. But yeah, Kegel exercises have a very specific way of doing it.
Mm-hmm.
So you can look that up. There's lots of stuff out there that can show you that.
As far as the Gleason test, Keoni, what is it? Do we know what it's actually measuring, or is it like a conglomeration of things that they're looking at?
So it's one aspect of the diagnosis of prostate cancer, okay? And we'll go over it again, but basically it's looking at the way the pathologist takes a biopsy of the prostate, right? Or the prostate is removed. They just go ahead and remove it, and they look at the cells, and the prostate has different regions to it. It looks almost like you can think of a walnut, and it has hemispheres to it to an extent. But anyway, they grade it based on how much the cells are differentiated or undifferentiated. Usually healthy cells are highly differentiated. You can see uniform. How they look. Yeah, they're more uniform in nature, whereas in cancer they have very, their borders look different. So you're looking at how they actually physically look. That's part of the Gleason score. And then you're looking at how far the spread of those aberrations look.
Okay. So if it's a tissue biopsy, where we're really looking at a lot of different factors.
Yes. So you're just looking. And so there's really two parts to the Gleason score. A high Gleason score, the score is scored from 1 to 10. A high Gleason score is not a good prognosis. So if you get a Gleason score of 10, that's a very, aggressive, advanced form of cancer. But it's just one aspect of it. But a Gleason score of 6 or lower really now should be kind of one of those wait and watch and just don't do anything to the prostate.
No, 6 or lower?
6 or lower, yeah.
Okay.
Yeah, whereas like 7 is more of intermediate level. And then once you get above 7, it's a little bit more advanced.
And now we'll go in. Do it. Should I save my Gleason questions for the next one?
Yeah, we're coming to it.
All
we're
right.
gonna come to it. We're gonna go into a little bit more detail about it. Hypogonadism, that's just basically, you can just think about the male with low testosterone maybe has like erectile dysfunction or just low libido. And we've hit on this: is testosterone contraindicated with prostate cancer or BPH? And not necessarily. And it may be more helpful than not. The perceived risks and what we've been told, the so-called media, the science media has been told that, you shouldn't mess with testosterone, especially if you have prostate cancer. But the research has shown just the opposite now. So let's just talk about that, some of the myths around it, right? So here's just some studies that talked about this issue. This is out of the American Academy of Dermatology. There is no evidence that testosterone stimulates the development of severe symptomatic prostate hyperplasia, nor does testosterone increase the risk of clinically significant prostate cancer. So there you go. I mean, BPH and prostate cancer doesn't seem to really have an effect on that. Followed 154 men with low-risk prostate cancer for 38 months. The investigators found low free testosterone were significantly linked with increased risk of developing more aggressive disease. So low testosterone seems to be linked with significantly more aggressive disease. So as men, before we even get there, if we have low testosterone, which we should get checked, we may be at risk if we do get prostate cancer for more aggressive forms of it, as opposed to our testosterone levels being elevated or optimal, and then we get prostate cancer. We're more likely to have a very non-invasive, not very aggressive form of prostate cancer, where we can probably live with it without any issues.
Yeah. At what age, Keoni, should someone start getting their T levels tested regularly?
We know that testosterone levels really start dropping around after age of 35.
Okay,
So
about
I
35?
recommend, I recommend them.
Annually?
I think annually, with blood work. I mean, that's what I typically do. I recommend for my patients, and I do myself, and get free and total testosterone as well as an estrogen level. And these things, are fairly cheap. So you can go on to do some of the online stuff if your doctor won't run them, or if your insurance doesn't cover it. Still, it's pretty cheap out of pocket to get that stuff done.
Okay. So 35 annually.
Yeah, I would do 35 annually. I probably wouldn't go any more than a couple of years without getting it done. But yeah, annually is optimal. But anyway, that's pretty significant that low testosterone levels seem to be associated with more aggressive forms of prostate cancer.
Yeah.
Now, what's that to say? Well, as we know, as we get older, our testosterone levels do drop, but we're talking about low testosterone levels more or less beyond what age brings on us as we get older. So as we get older and testosterone levels decrease, are they decreasing in a healthy way? Right. That's all. More studies, patients with lower levels of testosterone had higher risk of prostate cancer than did patients with high serum testosterone. Low T levels, testosterone levels are associated with increased percentage of prostate cancers and positive biopsies. Low testosterone is a risk factor for the development of prostate cancer. And these were out of the Journal of Urology, Journal of Steroid Biochem, Molecular Biology, 2006. It's there. You can just go into PubMed and find this information. Just type prostate cancer testosterone. You can find a lot of studies that kind of support this. We know that here's a big benefit of exercise. Exercise, any form of exercise, will help optimize testosterone levels, especially high intensity exercise. So, a lot of the CrossFit exercise, as long as you're not overdoing it, which I've been known to do, you certainly need to let your body recover, especially the older you get. But high intensity exercise is a great testosterone booster. There's a lot of other things that are great testosterone boosters too. There's some herbs out there. We talked about on one of our talks, just hanging out with women will raise a man's testosterone level. Hanging out with the opposite sex, hanging out with the sex that you're attracted to will raise testosterone levels. So
ours is going down as we speak.
Yeah. Well, like this isolation we're in now is not doing too good for our testosterone
That's a good
levels,
point.
right? Yeah. Low testosterone levels are correlated with that higher Gleason score, which we'll talk a little bit more. Again, another study, prostate cancer more common in men with low T levels. People with low T had more extensive disease. So we're talking about the aggressiveness there. One study showed that all men with a biopsy in the Gleason score of 8 or greater had low testosterone levels. Well, that's very interesting, right? So you biopsy a bunch of people, you find all the aggressive forms that have high Gleason scores of the prostate cancer, and they all had low testosterone levels.
Wow.
So testosterone is I don't want to get the point across to people that more testosterone is better. What we're trying to do is optimize it. We are not trying to be bodybuilders here. We're just trying to optimize testosterone so that we can function better.
Right.
So what's the definitive diagnosis of prostate cancer? Well, it's a prostate biopsy. There's issues with that, right? Think about what you're doing with a biopsy. You're actually like puncturing
It's
the
invasive.
prostate.
Yeah.
It's invasive. And think about if you're puncturing the cancer, is there a potential to spread it when you
Hmm.
do that? And a lot of oncologists don't think much of it because they're like, well, if you have cancer, then, we're going to treat it anyway. So what does it matter if a few cells get out? Well, that doesn't sit well with me because one cell getting out of the capsule of the prostate can spread cancer all over the body in time. So that's one issue of the prostate that can be very problematic. So it's kind of archaic. It's kind of medieval the way we diagnose it.
Yeah.
Um,
Do we have other options
there
at
are
this
other
point?
options. Yeah, there are some other options, but none of them are great
That's
yet.
a gold
But there is
standard.
something on the horizon called a liquid biopsy that will just look at your blood, which can help.
Yeah.
It's not where it needs to be yet. I think there's more research. It's not being used conventionally, but liquid biopsies for cancer are, I think, the new wave, because what it's going to do is it's going to detect the cancers very, very early, and more lives are going to be saved as long as people are getting those liquid biopsies, like annually or whatever. And
Yeah.
I think that's just around the corner. So, as far as like finding the magic bullet to treat cancer, I don't think we're going to find that for a long, long time. But what we will find is we're going to find better ways to find it early. And if we can find cancer early, you're going to have better outcomes.
Yeah.
So
Absolutely.
there's other risk factors with biopsy too. So think about that. You're puncturing the prostate. So you have all kinds of risks. That's a risk factor for hitting a nerve, or,
Mm-hmm.
you can still have some incontinence issues. These are rare, erectile dysfunction issues. The more common things would be like infections or bleeding, and just creating general inflammation in there, and increase in the risk of creating clots and things like that there. All right, so this is your question. Let's go into the Gleason score a little bit, and I'll try to explain it as best I can for how it relates to prostate cancer. So we've done our prostate biopsy, and now we look at the tissue, and we look at, so a pathologist looks at it, and you get a Gleason score. It's scored from 1 to 10, okay? But there's two parts to that score, and each part is graded from 1 to 5, okay? So the grades 1 to 5 of the two highest percent cell populations that are added together. So let me explain that. When you look at the prostate and you look at the cancerous cells, you find the largest area of cancerous cells that look one way, okay? That are, take up the most area, so to speak. And that gets a grade from 1 to 5, 5 being the highest. All right. And then the next highest population you look at, and that gets a grade. That may be 1 to 5 also. All right. So you're looking at the area that the cells take up, the cancer cells take up, and the percentage of the cells, and you combine those scores.
Okay.
Right. And so you'll get a score of, like, let's say you get 6, less than or equal to 6. That's considered a low grade Gleason score. So that may be an option for people to kind of like just wait and watch. Okay.
Mm-hmm.
The Gleason score basically helps determine the aggressiveness of the cancer. So without, probably my explanation was confusing, but just think about it that if you don't get anything else, it just helps determine the aggressiveness of the prostate, of the cancer that we're looking at. And a score of 6 or less is a good score to have, because
Okay.
you may not be able to have to go through treatment, and that may be the best option for you. Whereas a lot of people that were getting that score before were having, we're going through treatment, because it was kind of, I think fear played a role in that. Maybe there's also there may be some financial incentive. The more we treat, the better. Maybe there's malpractice issues for the doctor, so they want to treat anytime they find prostate cancer. But for the individual perspective, what we're finding now is that you probably don't want to jump right to treatment when you have a diagnosis of prostate cancer. 7 is an intermediate score, and then greater than 7 is a high grade or more of an aggressive score.
At what point, Keoni, are they gonna do this biopsy for you to find out this information? Is it going to be relatively quick? Understanding we're talking about healthcare here.
Yeah, it should. It's gonna be. Well, let's say you go into what would be some symptoms of having like prostate cancer, right? So those symptoms could be, well, I can't urinate anymore. I have to catheterize myself or something. What's going on? Or I have blood in the urine or something like that. They're not doing it as much anymore, but on a digital rectal exam, maybe you feel, the doc feels the prostate, palpates and feels the prostate that, the tissue just doesn't feel right. So that may warrant it.
And then so from there, the doctor first step would be kind of order that tissue biopsy.
Yeah.
After that. Okay.
Yeah. But he would look at a number of things. He'd also look at other markers. Mm-hmm. One of the big ones is prostate specific antigen, PSA. Mm-hmm. If that's been elevated and going up, if it's really high, you want to look at the trends of that. That does have some value, although it doesn't have as much value as they've been saying that they thought it did in the past. And there are other markers that we'll talk about also, probably in the second part of this talk, that will go over that. But just to reiterate also, just so you know, like if you let's say you have a Gleason score of 7, okay? The first part of that score may be 3, the second part may be 4. Or the score could be 4 for the first part and 3 for the second part, all right? To the pathologist, those are different scores, even though the score is 7. All right. And the reason why is the Gleason score can be written as 3 + 4 = 7. It means that most of the tumor is grade 3, and the next largest section of the tumor is grade 4. Okay.
Right. So we're just looking at 2 different aspects.
Right. We're just looking at 2 different aspects. Right. So just to reiterate, men with a low risk disease, Gleason score of 6, let's say their PSA is less than 10, that plays a role. And then there's another scoring phenomenon called the clinical state of the tumor. It's usually represented as 1 to 4, T1C or to T2A. Basically, all it's saying is it's basically defining, is the cancer still within the capsule of the prostate? Is a lymph node involved? Is it outside of the body? And then you also have that score on top of it. All right. Okay. So they're looking at all these things to determine whether treatment should be done. But typically with a Gleason score 6 or less, in the past, it's been over treatment. All right. And so anyway, but typically the way it was done, you get the PSA, it's going up, you have other symptoms, clinical symptoms, get the biopsy, gets diagnosed as cancer, and Gleason score of whatever you get, but let's say you get 6 or less at diagnosis. In the past, 80 to 90% of the men who got a Gleason score of 6 or less underwent treatment. And this is even for men that are age 75 or older, where that Gleason score of 6, you're going to die long before that cancer probably kills you. So you probably don't, for most of them. And so you probably don't need to go through treatment and have all the possible quality of life issues associated with it. Like, if I was diagnosed at 75 and my Gleason score was 6 or less, even if it was 7, the treatment, what is the treatment going to do to my quality of life? And do I really want to do that? And like I said before, a lot of this has to do with financial incentives, fear factor, malpractice issues, and things like that, why some doctors push treatment, whereas men really have to, be their own advocate here.
Yeah, exactly. I mean, just be informed about kind of the information we're given here, and then you can use that to make your decision.
Right. Yeah. So what are the treatments out there? Well, there's a radical prostatectomy, right? That's where you remove the whole prostate, and usually they follow that with radiation once you do that. All right. You can have one or both. All of those kind of have, their possible negative side effects though, so they can be problematic. The next form of treatment is the androgen deprivation therapy, and basically what this is they just deplete the body. They give you certain drugs that knock your testosterone, estrogen, all your hormones off, where you just basically have no hormones in your body. Now imagine a woman who's going through menopause. Now, men who get this ADT therapy done get hot flashes, so they don't have any hormones circulating. Imagine getting your maleness taken completely away from you, because this is the way men describe this, that I don't feel like I have my maleness to me. Whatever that means, doesn't sound good to me as a man, though, I can tell you that. Mm-hmm. And then you have no libido, your enjoyment out of life is completely decreased and things like that. And a lot of these people are on ADT in a continuous fashion. There may be a better way to do it as far as doing it intermittently if this is what you also choose to do. So we'll talk about that. And then there's another treatment called high frequency ultrasound. Now this one is pretty cool because it doesn't have the negative side effects. And this is kind of like our next generation treatments. And then you also have cryoablation, where you're freezing the cancer tissue. But the high frequency ultrasound really from what I'm seeing, it really sounds like a neat treatment. So anyway, I want to kind of just end there and just summarize some things, and then we'll finish it up. Next time, the next podcast that we do.
So what will we kind of cover on the next one, Keoni?
So I'm going to go more into what these treatment approaches are. And then I'm going to also go into the natural treatments. And that's basically what we're going to cover. And I think with doing that, what's going to happen is a lot of men will not feel like they're just, relegated to whatever to the whims of the conventional system. Mm-hmm. Because there's a lot you can do naturally, and there's a lot you can do before you even get your diagnosis. So that's part of the reason why I'm hoping that we have a lot of young men and women, people that have men with prostate issues or in the family can, kind of get the word out. I mean, that's the whole reason we're doing this podcast. So, and we'll talk about certain herbs that affect that 5-alpha reductase and also can help keep testosterone from aromatizing into estrogen, which is risk factors, right, for BPH and prostate cancer. We'll go into all of that and some other things that can help, just so people have that out there. We'll even talk about certain foods that are really good to eat that can really help your prostate. And hopefully, Brian, if we can prevent one person, even if it's me or you, from getting prostate cancer, in our old age, I think we did our job.
Yeah, sounds about right. Yeah. What did you want to kind of wrap up with, or kind of overview here?
So basically just, just go back over, there's lots of risk factors out there. We've heard of all of them. We've talked about them on a lot of podcasts. Obesity, there's family history. Vitamin D is a big one. The smoking, exposures to chemicals. Get your sleep. It's huge out there. It's the third most important key to life after air and water. It's a big deal. Get a handle on your stress, not just mentally, emotionally, but also physically. What are the physical stressors to your body? What are your exposures? How can you help yourself with that, with your lifestyle issues? Let's get rid of the plastic out of our lives as much as we can. In every way, try to drink out of glass, eat out of glass, don't eat out of plastic, stuff like that.
Yeah.
Supporting your liver and your endogenous detox mechanisms. We have a whole podcast on that, which is really important. Knowing the importance, like testosterone is a really healthy hormone if it's given appropriately and given in a way that keeps it from getting converted to estrogen or to DHT. Just know that there's a myth out there. The myth that testosterone is contraindicated in prostate cancer or BHP. It's just not true if you do it right. The other thing, low testosterone has been associated with increased risk of prostate cancer and aggressive forms of prostate cancer. We talked about how prostate cancer is diagnosed. You get your talk a little bit about PSA, your biopsy, your treatment, using the Gleason score, how to understand the Gleason score, and then just conventional therapies that are out there. That's the removal of the prostate, radiation, systemic therapy, which is the androgen deprivation therapy, and then newer therapies, high frequency ultrasound, cryoablation. And we haven't even gotten anywhere close to talking about some of the natural therapies. And with using some of the natural therapeutics as well as lifestyle, I mean, it will help you whether you have a diagnosis of prostate cancer, and it will certainly help prevent it from happening.
Yeah.
It will decrease your risk.
Awesome. Well, we will talk with you next week.
Sounds good. See you, everybody.